The newest age-defying breakthroughs.
Looks good! Okay, so if you want to look younger now, top New York dermatologist Dr. Lisa Iron is here to share the newest age-defying techniques to erase years from your face. I understand you have a new use for Restylane?
Yes.
Well, okay, tell us what that is.
Okay. Restylane is a substance that's used for filling in lines and wrinkles in the face.
Is that a collagen?
No, it's not collagen. It's a natural sugar gel. Hyaluronic acid is the technical term. As you get older, you tend to lose volume in your face.
Yeah.
And in the old days, the concept was, oh, we'll come in and we'll cut and we'll pull.
Yeah.
And a lot of people look very tight.
Yeah.
But they don't necessarily look younger, just tighter.
They just look tight.
Right. Tight.
Please tell them that.
So what we're aiming at as a profession now in the cosmetic profession is to add volume.
Oh, good.
It's a natural sugar gel. It's,
okay. I'm liking this. I'm liking the Restylane thing. Here's before and after of Restylane under the eyes. Let's look.
I developed a procedure with one of my colleagues where we could use Restylane underneath the skin in the lower rim of the lid to actually push the skin forward and help patients with this problem of looking tired and having dark circles, because there weren't a lot of great, easy, short-term...
Because in the past you would cut that and pull it up, right?
Yeah, but it's the same concept. You pull, it's tight, but you still don't have the volume.
And so how often would
this will last for about a year. Sometimes it lasts longer.
Great. I like that. Thank you, Dr. Lisa Iron. We'll be right back. Immediately following that show, Reggie flew to New York for his under-eye transformation with Dr. Iron.
Dr. Iron briefs him on the procedures. First, he'll have injections of Restylane.
What I'm doing is adding volume back into his face, which is definitely going to help him to look younger. All along the rim, from here all the way out to here. What I did, I made a little incision there, and then you put the cannula in, and we removed the fat from the pocket. If you compare the depth of his hollow from here over here, it's a night and day difference. I think he looks fantastic.
Okay, it's been 2 months since Reggie's procedure. Coming out, Reggie! Dr. Iron, how long...
You have 3 people makeup, and Reggie does your makeup, and it looks incredible the way he does your makeup. And then someone else uses the same makeup, and you don't get the same result.
Yeah, he's
and
a genius in makeup.
No, but it's the same thing with Botox. Like, I'm a genius with Botox. Like, I can use it. Thank you, Dr. Iron.
And there's one luxury biz that may actually be benefiting from the economic blues: Botox. Cosmetic dermatologist Dr. Lisa Iron says she's never been busier.
It's like they're not going to suddenly stop coloring their hair because the economy turned down. They're not suddenly going to stop coming in for their Botox injections.
Even if maybe they have to scrimp somewhere else, they'll still get the Botox, you think?
Absolutely. I mean, if it's a choice between the newest luxury handbag or looking as good as you can, I think people are always going to choose looking as good as they can. And then frown for me, and then relax.
So even though people may still be struggling in this economy, you may not see them frowning about it.
And relax. I just love what I do. I love being a dermatologist. I think it's a great job. I feel really passionate about helping women to look as good as they can.
What kind of procedures are the most popular?
The most popular procedures are Botox and injectable filling substances.
Do you think that there's almost an obsession in New York City?
I don't think it's an obsession, because I think it's become a really acceptable mainstream phenomenon. For a lot of people, it's the same thing as, oh, I need to get my hair colored, I need to get my brows done, and I also need to go for my Botox. So it's not something that has a stigma attached to it, such as that's an obsession. Nobody would say you were obsessed because you needed to get your hair colored every month. And I view that in the same way. Somebody called me at 10 o'clock the other night, and I was thinking, oh no, what's wrong, because she's calling so late, and she was calling to say that she had just gone to a party, and people were telling her that she looked so amazing that she had to call me on the spot and tell me, which I thought was really cute.
Joining me now is top New York City aesthetic dermatologist, Dr. Lisa Iron. So what are some of the biggest misconceptions, do you think, when it comes to black versus white skin, or black and white skin?
Well, in my practice, I treat patients of all color, from the lightest skin white person to the darkest skin black patient. And one of the biggest misconceptions that I hear is that the darker skin patients, when they come in, they're not aware that they can get things like Botox and fillers and different things like that. Like, they feel like, oh, I might get a scar if I get that treatment. And I'm always like, no, you can get Botox and fillers also.
Well, I know our audience has a lot of skin questions for you. Are you ready for some questions?
Sure.
Who has a question?
Do white women wrinkle faster than black women? And
Absolutely.
I also noticed that white women go and get Botox more often than black women do.
Well, it's actually true that white women age more quickly than black women do. And the reason why is because white women don't have as much protection from the sun. If you could choose, you would definitely choose to be darker skinned because you'll stay younger looking longer.
So you're basically saying it's our pigment.
New York City-based aesthetic dermatologist and beauty expert, Dr. Lisa Iron, believes it's never too early to protect and transform your skin. Her high-profile clients include those from the fashion and entertainment industries.
My philosophy about aging is that people want to look as natural as they can. When they look in the mirror, it's a reflection of who they are. And the rate at which you age is really more genetically determined than anything else, but you can control it by how you treat your body.
Dr. Iron says it's in our 20s we start to see the first signs of aging, so early intervention is essential.
I think there's always non-invasive interventions now that can really help them look good, all the way through the 20s, 30s and 40s.
Nein, das ist Dr. Lisa Iron, eine der erfolgreichsten Hautärztinnen New Yorks. Und sie steht ganz offen zu ihrer Leidenschaft für Faltenfüller und Nervengifte.
Ich liebe Botox. Ich denke, es ist eine der tollsten Erfindungen überhaupt.
Die Modenschauen im Bryant Park sind Pilgerstätte der New Yorker Upper Class.
Die Botox und andere Faltenauffüller, die man einfach unter die Haut spritzt, die sind eigentlich genau wie Haare färben. Sie helfen dabei, toll auszusehen.
Why are people more scared of wrinkles than they are of skin cancer?
Well, I think people have a basic vanity and they want to look really good. And especially young people, they're not thinking about cancer, but they are thinking about looking as good as they can. One thing I always try to get my patients to do in order to avoid getting wrinkles or skin cancer is to actually use their sunblocks appropriately. People should use sunblock every day, even on cloudy days, because you can receive as much radiation from the sun on a cloudy day as you can on a clear day. So it's important to use sunblock every day. I think it's mainly that people are really afraid of getting older and they want to do what they can to prevent the aging now. And so a lot of people, at least in my office, would be there already for Botox, fillers, different types of things that are going to make them look better. So if you say to them, if you wear a sunblock, this is also an anti-aging cream, that's going to definitely help with the compliance.
So are you finding yourself doing that then?
Yes, absolutely.
I
tell people that if the skin cancer doesn't scare you, let the vanity scare you.
Okay, well that's good. It scared me. Dermatologist Dr. Lisa Iron, thanks so much.
Thank you.